You're watching TV9 Digital. I am Adarsh Webachedu. There is tons of oxygen coming into the country from various countries. Private companies in India are also manufacturing plenty of oxygen. And on the other hand, you have the Oxygen Express bringing oxygen from point A to point B across the country. Despite all of this, several hospitals in several states across the country are raising SOS about lack of oxygen in their hospitals. Why is this the case? I had a word with public health expert Dr. Ambarish Datta, and this is what he had to say.
Many thanks, Dr. Ambarish, for speaking to us. Doctor, there is a wide gap in demand and supply, at least that's what it appears at the outset. How do we bridge this gap with the stocks that we're getting from abroad? And do we really have less than what we need in terms of oxygen? How do we really prioritize if that's the case? Because on Monday, the government had said that there is enough stock of oxygen in the country. So where do you think the problem really lies? Is it logistics or is it a shortage that we don't know of? And what do you really feel is the need of the hour right now?
In terms of oxygen, you see, it's demand and the supply. The matching these two is not as easy as, say, for example, medicines or vaccines. Because the demand keeps fluctuating and you never know that when you would be, because I'll just give you an example. If you look at, say, for example, the city like Bengaluru or Delhi, they are increasing oxygen supported beds every day and by quite a few notches every day. So the oxygen demand keeps rising for supporting those beds. At the same time, you see, not every patient would need the same amount of oxygen, high flow oxygen, low flow oxygen. There are so many issues out there. And also, the bed occupancy keeps fluctuating. People from surrounding areas flock to the big cities and occupy beds. So, again, oxygen demands changing. So, the supply from a centralized point to all these peripheral states as well as from the state headquarters to the hospitals, the actual centers that are utilizing the oxygen, measuring the demand and not stockpiling, not hoarding, but just using what is necessary at this hour remains a challenge.
So Doctor, do you feel that a dashboard of sorts, where every state, should make a dashboard of its own and feed into a central dashboard eventually, as to how much oxygen they are getting on a daily basis and how much oxygen there seems to be a requirement of?
Absolutely. That is the need of the hour. There should be transparent, measurement or estimation of the requirements, and which should be published in web portals, dashboards, and which should be collated at the central level, and the distribution from the center to the states should be based on that. And the center should also be transparently publishing them, that how much has been supplied to each state.
Right.
So that this dashboard guides the entire process, the supply chain management process, the inventory management process, and the logistics as well.
Right. Doctor, my next question is, despite the fact that private sector in the country, you have a lot of companies producing this oxygen, you also have the Oxygen Express that is taking oxygen across hospitals, across various states in the country. But there still seems to be that very important question, how is it being used and whether it is really being used the right way? For instance, in Delhi, there is only 447 metric tons of oxygen that is currently remaining. That's what the Aam Aadmi Party sources are saying at this point in time. So we are having to believe them right now. What they're also saying is the demand is 700 metric tons, and now they've increased their demand to 976 metric tons. So ultimately, oxygen is reaching Delhi. But my question is, how much of it is really being used for the right purpose? Because we keep hearing about how oxygen ends up in the black market and things really don't pan out the way they're ideally supposed to.
Yeah, that is why a dashboard, a transparent dashboard would be the best way to go about it, and where the state government publish it and shows that which hospital has received how much and how it is being utilized, at what rate it is being utilized every day. Just like we have dashboards for new cases, new testing, test positivity rate, deaths and all that. It can be done for oxygen also, because now oxygen has become one of the most important life-saving, I would call it, drug. And so it has to be very transparently monitored throughout the procurement, supply and utilization process. And that would be the need of the hour.
Right. Doctor, I'd like to draw your attention to what happened in the Chamarajanagar District Hospital in Karnataka. 23 patients just like that lost their lives because there was a lack of oxygen that was reported. And when we dug deeper, we came to know that the district in charge, the district commissioner of Mysuru, who happens to be Rohini Sinduri, she apparently intervened, due to which the cylinders did not reach the particular hospital on time. So even to this day, we are coming across instances of lack of coordination. That seems to be something that is very clear. And this is something that is happening despite the government clearly ordering that there should be seamless transportation of oxygen between districts and between states. So what is your thought on the lack of coordination that is clearly there to be seen in various cases across the country?
No, I wouldn't like to comment on that particular cases because I don't have the entire background of that and the details. But yeah, lack of coordination can definitely impact negatively into this entire process, because as I told you, it's being procured somewhere else, it's being transferred to somewhere else in the state, from where again it is being distributed to actually the point of care where it is being utilized. That are the hospitals. So it needs to be sort of, the entire operation has to be operationalized through a very well drilled database system. Unless that is being done, there would be lack of coordination and there would be unfortunate incidents due to shortage of oxygen.
Right. Many thanks, Doctor, for speaking to us on this very, very important and pertinent issue that the country currently faces.